Hello, I'm Dr. Minera. I'm a board-certified family physician and board-certified obesity specialist. And welcome to Comprehensive Medical Weight Loss Solutions. As a primary care doctor, I have been used to managing patients who have chronic medical conditions. Once I realized that a lot of the root causes of their disease processes was based on being overweight and metabolically unhealthy, I started to explore the specialty of obesity medicine. My passion for preventative medicine and helping patients help themselves and improve their health is one of the main reasons why we started this practice. We want them to feel that they're in an environment where they can be themselves, they can actually open up, and we are better able to help them that way. The other piece of it that's very important to us is that it's not only about understanding our patients, their comfort level, but also the quality of care that we are committed to providing for them. And wrapping all that up in the same offering was very important to us. So success can have a different meaning for different people. I am of the thought process that success is dependent on what goals we're able to achieve. If we achieve any type of progress, either in your health, in your overall mental health, in your attitude, in lifestyle, then for me, that is success. We don't measure it on the scale. We don't measure it number-wise. I think it's an attitude and it is a overall love for yourself. Quality patient experience is not only about ensuring that the people that are greeting you and receiving you here in our office are empathetic, knowledgeable, and friendly, but also the environment has to be ideal for that experience to be shared. So that's why we have chosen to create the environment that we have. At Comprehensive Medical Weight Loss Solutions, it's very important for us to ensure that you're getting a customized plan, something that's tailored specifically to you. And in order for us to achieve that, we have a conversation. We need to understand who you are, where you're coming from, where you have been in the past, and putting all the information together, including your medical history, family history, etc., we will formulate a plan that is specifically tailored to your needs. We are always committed to practicing evidence-based medicine. That is something that's very near and dear to me, and it's key, the key component in developing a program that is specific, individualized for each patient. With that, we follow the pillars of weight management, and we have patients come in on a regular basis, depending on what their needs are and what stage of weight loss they're in. And we ensure that we do a full follow-up for them, initial workup and follow-up based on each individual plan. So one of the key things for us is having a overall intake questionnaire, because we want to try to find out what patient expectations are. It's very different what patient expectations are from what my expectations as a provider might be. And what we need to do is come to a common agreement as to what our overall objectives are. I like to use SMART goals, and so I want them to be very specific, but of course I want to keep them manageable for the patient and make sure that we have a way to have those small victories and small successes, whether it's on the scale or it's in body composition or it's a change in overall attitude, a sense of more confidence in what they're doing, education, they feel a little bit more versed, be it in nutrition or in physical activity or exercise, or even a better understanding of their own metabolic condition through lab work. At the end of the day, there are multiple variables that we can measure and we can attribute a success rate to. When a patient walks in the door, they are a blank slate. When they leave here, they're going to be much more knowledgeable. And that's why for us, it's very important that when they come in here, we emphasize the fact that we want to empower them to have the blueprint for their body, for their metabolism, for what plan is going to work for them.